Now back to the Dana Barrett Show here on WGST.
You know, I have been critical of all of us and the media on the whole. When I say all of us, I mean all of us. Listeners, viewers, consumers, citizens, Americans, and the media for being so easily wagged from subject to subject, so easily distracted from whatever the topic of the day is or the week or the month to the next thing, you know, from a mass shooting to, oh, we're firing Kirsten Nielsen to, you know, from we need healthcare reform to, oh, we're not talking about that anymore. Now we're talking about fire somewhere. And I am making maybe I'm going to make my New Year's resolution early and just say, you know, for 2019, you know, for the rest of this year and for 2019, I really am going to make it my mission to try to continue to talk about the issues that, you know, are important, that aren't necessarily at the top of the headlines, because that is the only way we're going to affect change. So I am going to keep talking about upgrading our voting systems in this state and in this country, even when we don't have an election that's in the middle of brewing. Like, I'm going to talk about it anyway. And I'm going to continue to talk about gun control even when it's not 2 days after a mass shooting. And I'm going to continue to talk about healthcare reform. And on that note, I want to mention, by the way, if you're not aware of it, it is time. It's open enrollment right now, and there are changes to Obamacare. There's no individual mandate anymore. So if you don't want to have insurance, you don't have to anymore. There's no penalty. That said, in Georgia last year, if you are self-employed and you had to get your healthcare through the marketplace, there was one choice. Well, there were two. I think there was Ambetter last year and Kaiser. And this year, there's a third choice. And so go look. Don't just automatically sign up for what is what you had this past year. Go look, because Anthem Blue Cross Blue Shield is back in the mix in Georgia now, and there are cheaper options than what there was. So go take a look and make sure you sign up for the right thing. See, that's not a headline. That's just me looking out for you. I looked. I have to do it. That's how I get my health care, and because I'm self-employed, and there's some better deals this year. Listen, it's still, let me be perfectly frank, it's still crappy healthcare insurance. It still barely covers anything, but at least if you're going to have crappy insurance, it's a little cheaper. And I don't mean a lot cheaper, I mean a little cheaper, but you take what you can get for now. But we do need to stay on that. We also, like I said, need to stay on this gun issue and stop allowing our politicians on both sides, but in particular on the right, from being beholden to the NRA. And there is a new story that has bubbled up into the news, although it's probably not the top headline. But there is a news story because the NRA kind of went after a group of doctors and told them that they needed to, quote, stay in their lane as it relates to gun policy. So the message that the NRA sent was posted a week or so ago, and now the doctors, many doctors are fighting back and saying, you know, we have a right to look out for the health of the public. That not only a right, but that is what we are tasked with as doctors. What the NRA said was in a tweet. They sent the tweet out, and it said, quote, someone should tell self-important anti-gun doctors to stay in their lane, end quote. Someone should tell self-important anti-gun doctors to stay in their lane. I would argue that someone should tell the self-important gun sellers to stay in their lane and stop trying to act like they are Second Amendment defenders, because they are not. They are gun sellers. Let's be clear about that. In any case, this has it has bubbled up because the doctors now, as I said, many doctors, there's groups of doctors, individuals that tweeted back, that, you know, clapped back as best they could at the NRA. But ultimately, they are standing up for some form of gun control in response to what's a crisis, they're saying, not just a gun crisis, but a healthcare crisis in this country. And that's an interesting way of looking at it. And I suspect most people haven't really looked at the gun issue as a healthcare crisis, as a medical crisis, a public health crisis, if you will. But it is. If we had as many people dying from a disease, we would have teams of scientists looking at it. We would have pharmaceutical companies doing drug research to try to fix it. But because it isn't, and because of the power of the NRA, nothing happens. We have people being shot and killed on a regular basis. Forget the mass shootings, but overall, every day. And we just report it and move on. And we gripe about it, and there's groups that care about it, but ultimately we just move on. Well, this morning, a guy named Dr. Joseph Sakrin, who is an ER general surgery director from Johns Hopkins in Baltimore, and also a gunshot survivor from his teenage years, was interviewed about this. And first, he responded directly to the slam, the tweet from the NRA. Listen.
I think when you hear that type of communication, it really tells me, the rest of the medical community, and Americans all across this country that they are not serious about moving the needle forward on this issue. And so that type of rhetoric is not helpful. And anyone that understands how complex a problem this is will realize that this requires stakeholders from all walks of life to participate in order to move it forward.
Including gun owners. You know, nobody is saying that we have to take all guns away in order to try to prevent some of what's going on. But we have to be able to have conversation about it without name calling and without. Why did the NRA have to tweet from their official NRA Twitter feed or Twitter handle? Why did they have to mock the doctors? Doctors! Why are they mocking doctors? ER doctors who are dealing with the blood and death of people coming into their hospitals on gurneys every day. Why? Look, we focus on these mass shootings, but I say this all the time. I say it here in Atlanta because it happens. Every day, if you turn on the local news, they talk about a shooting. Somebody got shot almost every day. For all different kinds of reasons. Well, Dr. Sakrin was asked about that and made some comments about mass shootings versus gun violence overall. Listen.
I think something that's very important to kind of point out is, you know, the mass shootings get a lot of the highlight here, but they're less than 2% of the problem. Yeah. And we have young black men that are being killed every day in cities like Baltimore. And so, Jim, we have the possibility and the responsibility to ensure that their stories are heard and ensure that we implement common sense solutions to make communities safer all across this country.
Their stories are never heard. I mean, we barely hear the stories that are of the people that are killed in the mass shootings. And if we do, we forget their names and their stories within a week. Then Dr. Sakrin went on to classify gun violence as a public health crisis, which I think makes a lot of sense. Listen.
Well, I mean, if you think about what a public health crisis is, it's a complex health issue that occurs in different geographic areas throughout the country. And when you look at what we've done in other similar problems like motor vehicle fatalities, for example, you know, in the 60s and 70s, we didn't get rid of cars. We came up with seatbelts and airbags. We made roads safer. It's about time that we take this issue on and deal with it like the public health crisis that it is. Yeah.
Hear, Dr. Joseph Sakrin, who is an ER doctor, who has been shot himself and who knows of what he speaks. We need to take this on like it is a public health crisis because it is. On that note, we are out of time. We'll be back tomorrow. See you then.